Thanks, Michelle.
You're welcome.
Looks like that's working. Go ahead and advance to the next slide. This is our monitoring slide. This gives the information that Melissa and I, who are speaking today, don't have any disclosures. This session counts for 1 credit hour. You can claim that credit hour even if you attended the session previously about environmental triggers. We'll do a refresher today and hopefully overcome some of the technical difficulties with the videos we had last time. So next slide. Just a quick review of the objectives of this course series being to reinforce skills and knowledge around delivery of asthma self-management education to children and families to help support them. We want to be able to identify children with suboptimal asthma control and apply the content areas for education for the children and their families. Incorporate the 2020 asthma guidelines, learn how to do an Envision walkthrough, and we'll try to get that video going today during this session. Want to be able to nominate your school for asthma friendly school recognition, and then we'll also have this for a forum for case discussion and questions. And I feel like our short slides are a little shorter today too, so if you have any case questions or discussion, even if they're not related to this topic area, feel free to have those ready anytime as we go or at the end. You can put it in the chat or raise your hand and we take a break for questions, or we can do those at the end. Next slide. So today we're talking about asthma triggers and tools for trigger reduction. And if you're working on applied work with students, had some suggestions about where to start. It's okay to start anywhere in here if you're starting with identifying a student to work with doing asthma teaching, or if you're partway through already, this would be to continue asthma self-management education. And this would correlate with a teaching video about asthma triggers and then thinking about an Envision walkthrough for your school. Next slide, and I'll hand over to Melissa.
Okay, so we're going to talk about asthma triggers and tools for trigger reduction and give some fun facts and then some little, identify some triggers and see what happens. Anyways, we can go to the next one. So this kind of was a similar slide to like I brought up earlier that over why we kind of are doing what we do. Department of Health is trying to help decrease the amount of asthma exacerbations that children have. Over 50%, 51% kids have a flare. 38% of children has had one or more in the past 3 months, and 56 of them lasted for hours, days, or weeks. So that's quite a bit. Of half the children with asthma are having flares, and that means they're not controlled. So we're trying to help decrease that number for a variety of reasons. Next slide. So this is just some some fun facts about Vermont, and we have triggers. We have lots of triggers in the home as well, because we're unique with our state that we live in. And so kind of like the biggest culprit is the indoor pets, and winter's cold, so everyone's indoors for a really long time. That's the biggest culprit. Pets in the bedroom, so we always try to encourage them, if they, because no one gets rid of their pet, to at least try to have the pet stay out of the bedroom and with a closed door. Carpets in the bedroom is another one. Hence, we'll get back to it later about one of our vision walkthrough and the weed program that we've talked about before to help with people affording to get rid of the carpet in the bedroom. Cooking with gas and wood stoves. Those are another 2 big culprits that tend to help have kids exacerbate. And 84% of these children are exposed to 2 or more triggers at home. Obviously, most likely is a pet, and a wood stove is pretty common that a lot of families have in there. So we trying to help work with the families and identify what we can do to help minimize their triggers in the home. And over 43% have 4 or more triggers. So that's quite a bit. So that's why we're here, trying to help as much as possible, try to decrease any little bit that we can. Okay, next slide. So this is kind of just some more fun facts about everything. So most providers with asthma, so 84% of children have 2 or more environmental triggers in their homes. That's quite a lot. The most common triggers for children at home are indoor pets, pets in bedroom, gas stoves, and wood stoves. And then we haven't even taken into consideration the whole tobacco, smoke, vaping, and other kind of factors that these kids are exposed to as well, which obviously adds another trigger for, and it's a really bad one, that being exposed to tobacco smoke or vaping or any of that smoke will oftentimes land the kid in the hospital for an exacerbation due to just the frequent recurrence of being exposed to secondhand smoke. So that's a really big deal as well. Next slide.
I can take
Yeah.
over here. So I'm going to share some of the guidelines from the 2020 asthma guideline updates about indoor allergen mitigation and management of asthma. And let's say that the allergy recommendations were one of the specific topics on the 2020 targeted guideline updates, but they're not super robust, and that sort of speaks to how challenging this problem is, because people have various triggers. There may not be one solution to that. Everyone's home's a little bit different, but in general, the allergen specific mitigation strategies are conditionally recommended for children who are sensitized to, meaning they have a positive allergy test or have symptoms related to the exposure. That'd be an example if kids don't have allergy testing or it did not pick up that specific trigger. And most of the allergens need multi-component intervention, meaning they need more than one thing done to decrease the trigger. The pests, so mice or cockroaches, integrated pest management can be a single intervention for this. That can be pretty effective even just on its own, or it can be part of a multi-component intervention. That's basically the only thing that really responds to a single intervention of doing pest management, but that's a pretty big undertaking sometimes. For identified indoor allergens tend to need a multi-component allergen specific strategy. So an example of this is dust mites. We like to do the pillows and mattress covers. People like those. They're really effective only as part of a multi-component strategy and not really as effective on their own, unfortunately. Next slide. So let's talk about some of those multi-component interventions. So back to the dust mite, those are problematic year round. Those can peak in the fall. So allergy to dust mite can mimic the seasonal allergens when you see that fall peak. It isn't always the grasses and trees, it can be dust mite. And the multi-component interventions for this are the pillow and mattress encasements. A big one would be washing the sheets and bedding in hot water weekly. That can be pretty challenging. Minimizing the bedroom carpet, curtains, stuffies. Dust mites like humidity, so maintaining the humidity under 50%. HEPA filtration isn't helpful here because these are surface critters. And when talk about humidity, this little picture here that has the numbers on it, that's a hygrometer. So that's one inexpensive device that families can use. Usually recommend something in the under $10 range. You can get it. Some are on household devices, but this is like a standalone one. Usually comes with a little magnet you can stick on something, and that'll let you know how humid it is in the house. So your house can feel really dry, might be tempting to run a humidifier, but if the humidity is already really high, then you risk the dust mite and mold flares. Animals, those can be year round, obviously. So ways to target that allergen, if there's animals in the house still, is to eliminate or reduce the carpet, use a HEPA filter in the bedroom, pillow and mattress encasements, HEPA vacuum, and keeping the animal out of the bedroom. That can be pretty challenging, with ventilation with a closed door, but really that's the best way if the child has a safe sleep space. Then we get to molds. That's year round, especially in the fall. Removing obvious mold and leaks, helpful. Mold also likes humidity, so maintaining humidity in that 25 to 50% range. The reason we don't really go lower is the airway is fairly unhappy at that lower humidity, but we also don't want to go over that 50% where the mold and dust mite likes to thrive. Also for molds, if there's exhaust fans in the house, it's really important to use those. If you're getting windows steamed up with bathroom humidity or humidifiers, I think that's too much, and using the exhaust fan can reduce that somewhat. Then pollens, the trees, March through June, typically grass, May through June, weeds, August and September. It's important to try to reduce the bedroom exposure, closing the windows, avoiding fans, air conditioning can help for some kids, window filters instead of open windows. And then if they can keep windows closed in the car, sometimes have kids like bathing before bed, getting that out of their hair and off the skin. Some of those things can help. And then mice and cockroach, then integrated pest management is the solution for that. Slide. So we talked about these single and multi-component interventions. So the evidence is not very conclusive due to lack of studies. It's really, like we said, really challenging to do. So single interventions generally not associated with improvement in the asthma outcomes, either inclusive or no effect with most strategies. No, I mean, if people were doing one, single component and their allergy symptoms were much better, that's great. They certainly can do that. If we're looking at improving asthma control through reducing these triggers, these single interventions don't necessarily fix the problem. If we're looking at asthma outcomes, multi-component interventions are more helpful in reducing exacerbations, but we don't have a specific combination of interventions to recommend. So generally, those things on the previous slide are what we would suggest if those are triggers for a child. Next slide. This one, I won't go into the great detail, but this is just showing you what studies were reviewed in the asthma guidelines to come up with those recommendations for what might work for children and what the evidence level was. So not a lot of studies, mixture of things that were done to reduce these triggers. Next slide. And then the other things to consider, some of these are pretty big undertakings to reduce triggers. So if kids do not have allergen sensitivity, or that is really unlikely to be the issue, then addressing a lot of these triggers can be really expensive and maybe burdensome to the family if that's not bothering them. So thinking about how severe the asthma is, how bad the allergy symptoms are, and then how, what's the level of interventions that the family is able to do. It's not very equitable at times, the access to specialists and allergy testing for kids. So it's recommended that clinicians should at minimum take a history of symptoms and exposures for people with asthma and have that history help guide the need for allergen mitigation and testing for allergens. Next slide. So talk about some options for checklists and tools to use to evaluate the home environment. One of these is the EPA asthma checklist. There's some links here, but what I'll show you on the subsequent slides is what that checklist looks like. And this is nice because it gives some things for families to visualize, well, what could potential triggers be at home and what they may suspect to be problematic. And it gives some what are mostly low-cost solutions for intervention. And these checklists were identified for home visitors, so someone coming into someone's home, looking around and advising the family. It's not a resource we have a lot of places, so this is something that we can go through with families and that families can go through on their own to look at triggers. And then it's also fine to use some structured questions on your own to target some of the key factors, because sometimes doing a long form like this can be burdensome for families. So thinking through, well, I'm going to ask about pets in the home, pets in the bedroom. I'm going to ask about smoke exposure, some things that maybe trigger environmental triggers for kids, even if this checklist is burdensome. Next slide. So when families go through this, you can see here there's some building information, home interior, you talk about heating and cooling. This is where you can learn about, families can learn about air conditioning, what type of cooking they're doing, what's the cooking stove, thinking about those exposures, smoking. Next slide. And then goes on to pests. And the nice thing about this is that they give some suggestions for potential actions if this is a problem. Like if in the last 12 months you've seen cockroaches in the house, give some suggestions about how to handle that and some potential strategies. Then it goes on to moisture and mold in the home, um, more about pests, and then some summarizing some of the chemicals and exposures that may be around. Slide. Then it goes on to dust mites, mold and moisture, and again, giving suggestions about how to decrease dust mites and actions to decrease moisture and mold in the home. Next slide. Things that were not addressed in the updated asthma guidelines were smoking, vaping, e-cigarette exposure or use. Those are still really high priority to address. And then other indoor air pollution was not addressed in the updated guidelines, but obviously that's still important as well. Next slide. So we'll talk a little bit about indoor air quality. There's a lot of factors at play with indoor air quality. It's important in a lot of health outcomes, not just respiratory disease, but also cardiovascular, neurodevelopment. And some of the major components of this are coarse diameter, which is less than 10 microns, and fine diameter, which is less than 2.5 microns, or PM2.5 particulate matter. The problem with these is those travel deep into the lungs and those cross into the circulatory system, and that's how they get around the body to cause different adverse effects. And we see then from with particulate matter and other factors that is closely related to respiratory health. So example is that with sinus symptoms, asthma symptoms, allergic symptoms, the air pollutants PM2.5 and nitrogen dioxide are examples of pollution that causes problems with these symptoms. And kids are inside a lot, at home and school. Their outdoor time is fairly minimal, especially the younger they are. So the indoor air is a significant source of the particulate matter for them. It's not just outside. We think about particulate matter, these last couple of years been more aware of that with forest fires, smoke explosion in the air, but people are exposed to this all the time at lower levels in the home, and there's not a safe level of exposure. Next slide. So with indoor air, what's different than the outdoor air is you can typically do something about this. So reducing combustion sources, improving ventilation, and optimizing humidity. So this little diagram shows the steps in dealing with it. So best to remove it if you can remove the source of the problem. So if someone has especially an older wood stove that's putting excess particulate matter in the home, removing that and changing heating source or swapping out to something that's producing less particulate matter would be better. Separating, so like the pet, like not having a child's bedroom. Ventilate, so if you can improve ventilation in the home or filter it out would be the steps that are ideal to get rid of it. So for wood stoves, so alternative heating sources, improving wood stove burning practices, those are really important. And we have a lot of patients who have wood stoves that they clearly have symptoms with, and it's often a decision for families who, if they have more than one heating source, of what's less expensive during that season. So that's a challenge that families encounter pretty regularly. Gas stoves produce nitrogen dioxide. That is bad. It's really challenging because people like to cook with their gas stoves. Not everyone has a hood that works. So running the hood that vents to the outside, not just running a hood that is just a fan, but hoods that vent to the outside are important here. And then if they're really unable to swap it out or vent to the outside, a HEPA filter with a carbon filter can help with this. So the HEPA filter will reduce particulate matter, which also comes from cooking, but the carbon filter will reduce the nitrogen dioxide produced by the gas stove. Slide. And then we'll talk about weatherization. So that's something that also improves home conditions that affect health. It improves the home, so reduce energy bills, improve temperature control, improve air quality, improve safety, reduce humidity, reduce mold, reduce pests, not pets. Um, and health benefits, this can help quite a lot. We think of this, in our clinic typically for respiratory symptoms and asthma, sinus symptoms, allergy symptoms. It helps a lot of other health conditions as well. And some of those are probably longer term health benefits. We tend to see the respiratory stuff sooner, those benefits, but probably long term health benefits like cardiovascular and neurologic health benefits. And this generally goes with the improved air quality in the home. And we currently have a program with called Weatherization Health Initiative, where kind of winding down. We have a good number of kids in this program already, but it's a partnership with VDH and state weatherization groups to be able to refer children with asthma for home interventions at no cost to the family to do weatherization for their home and some healthy home tools. Molly, I don't know if you want to put in your chat where you're located, and in your email if you might be interested in me sending you some information about that program. And we're just taking referrals the next couple of weeks since it's winding down. But if you feel like you have someone who might be interested, you're welcome to share that. And then I'll turn over the slides. I think I'm turning over to Melissa with the next slide. We're going to talk about the Envision program. Michelle will share some video and some comments for that.
So disclosure here, this is Karen's real expertise, but the Envision program is a really great program for schools to promote healthy school environments. It's a great way for you guys to have supports and have access to figuring out how good your school is doing. It kind of started in 2000 and it's been kind of a rollout since then to try to help get your school all geared up. I don't know if you want to start the video and I can talk about it after, if that works for you, Michelle. If you can try to see if you can play that, see if it's going to work.
Yes, let me try.
Even healthy students affected by indoor air pollution. Our students with asthma and allergies, we need to be very mindful. We notice an increase in kids coming decks. Sometimes they just might not feel like themselves. They might feel more tired, not able to focus. We really wanted to make sure we were doing everything we could to have a healthy school. We reached out to the Envision program to help us. Let me show you around. We're so thankful to have you here.
Yeah, thanks for having me. So one of the first things to look for when we come into a school is that's most of the dirt and dust that comes into a school building enters in the entryway. So if you have walls down at the entryway, that can dirt and dust from getting into other parts of the school building. Locked ventilation units is something that we commonly see in schools. And while these are nice storage shelves, it's important to keep them clear so that fresh air is constantly coming into the classroom. Disinfectants are another common thing that we see in school classrooms. And while disinfectants have their place building because of the chemicals and the fragrances that they contain, they're generally not safe for general classroom cleaning, cleaning off the desks and the tables. And they certainly shouldn't be used by kids. So you want to make sure that your cleaning products are certified by a third party that says that they are environmentally preferable and for students, staff, and the environment. And these are great examples because they both have that third party certification. This is exactly what we want to see. So this is great because the air intake is not blocked at all. A lot of times what you'll see in a school that has ground level air intakes is landscaping that grows up along the building and blocks this vent. Or sometimes there might be a parking spot here and you could be pulling in potentially bad air. So this is perfect. So one thing that can be helpful in a bus loop like this is to have signs up to remind the buses and parents dropping off their students to idle their vehicles. And that's important, especially on school grounds. If it's close to the school building, that air can be pulled into the classrooms. And if it's close to a playground, that air is around where the kids are playing. So just having that reminder is usually enough to help fix that. So that pests need. They need food, shelter, and water. And one great way to eliminate their is by having a strip like this or some sort of gravel strip along your school building. And that prevents vegetation from growing up against the building and being a place can hide and shelter.
You can do a complete inspection of your school using our online checklist, or you can ask the Envision program for help. If you answer yes to a question, you're following the best practice. If you answer no, a recommendation pops up.
So as you can see, most of the things that we found at your school today were easy, low-cost fixes that can help improve indoor air quality here at the school.
Okay. Thank you, Michelle, for that seamless video. It's so much better to have the video. And
I'm here to show you what to do if you see someone suddenly collapse and they don't seem to be responsive. First step, we're going to ensure that there is no danger. Then we're going to check for response from the person. We're going to ask them a few questions and we might...
Okay, I think we're good.
It did seem really helpful though, Michelle.
We can all learn CPR again. We can always do a refresher, right? Sure, everyone's so sick of seeing that. So Envision walkthroughs, as you saw the video, very easy to do, very kind of low-hanging fruit, doesn't take very long, and it's just great to kind of get and assess where your school is at. And then there's earn points to nominate your school, and if you win, you get extra stuff and all that jazz. Just first one is there's enforcing state laws, so that's kind of learning about those, bringing them up to your school administration, and kind of like the no idling, safe cleaning supplies, and then the signs that say no tobacco use, and kind of all the basics that most schools have, but some kind of get torn down or forget about, or I know the no idling is kind of hard ways reinforced with all. I know in the town I live in, a lot of families pick up their kids and they sit there and wait idling, I'm sure, even though I think there's signs everywhere that says don't idle, just to kind of encourage the parents to stop idling. I know the buses don't idle, and like a lot of schools now have some electric buses as well. And then just working on enacting best practices. I know the school nurses work really hard about making sure their asthma action plans are up to date, that they have them, they're on file. And then the cleaning products, again, a lot of times parents think it's great and help, with the supply list, but really that should go through the school and their and who they use for cleaning products. Then the next level would be establish plan, policies, improvements, and that's kind of what the vision can also help with is HVAC improvements, purifiers, maintenance, fragrance-free policy, and training staff on asthma basics and emergency response, which I'm sure you all do that, and especially in the fall, and that before the school starts in session. I know there's a lot of training that happens at that point, and as well as the HVAC, I feel like since through COVID has really, a lot of schools really addressed that. So that's one perk of COVID was that a lot of schools got a little bit of a refresher on that. And you just go on that web line and fill out the online tool, print it out, and it gives you a lot of information that way. And then on the side here, you can see like the bronze level, you need to have 4 of the best practices and kind of move up, and then you get bonus as well. Then you can get nominated for the Vermont Asthma Friendly Schools, which is great. You can put it in your, if you win, you can put it in your sign somewhere that shows that you took all these steps to make this happen. You can do the next slide. Oh, thank you, Michelle, for touching that. So this is kind of a fun one. We don't have a big group today, so I won't bother everybody, but it's kind of, can you spot the triggers? It's kind of a fun one. And, you know, obviously the cat in the room, all the stuffies on that bed, which make it so cozy, but, you know, they hold all those dust mites. Then there's obviously the dust mites on the magnifying glass, just trying to, the carpet in the bedroom, the raking outside. It's just kind of like being aware and hitting some of those, all the triggers. And you can always talk to the kids in your class too about how can they some of the triggers in their bedroom. Even some small changes would be really helpful for them to kind of educate them what triggers are. So this is a fun print that you can print it out and have the kids kind of circle it and kind of make, you know, so they can learn what triggers are and they can identify them and be aware of them. Next slide. This is another brochure, which is great too. We used to have these in our clinic. They're nice little trifolds, lots of information on them, and just kind of goes over some of what we've talked about, how to tackle your triggers, and, you know, send this home. Maybe the parents will kind of read it and kind of, you talk about it with the kids, and, you know, even if they make a couple changes, it'll really help them feel better, breathe better, not be having exacerbations, not missing work and school, and really trying to help break that cycle. So these kids are just sick all the time. And if they can just make some smaller changes to hopefully help decrease the amount of triggers they're always being exposed to. And this is a great little handout that's also there. There's a website for that. The State Department does have a really good website with all kinds of really great materials on it. Then obviously, I know everyone knows this, but you can't say it enough. Stop smoking, vaping, whatever you want to, everything is bad. So, you know, 1-800-802-QUITS, and there's great resources there. There's a hotline that they can just call. They really support you, give you information. They ship you to supplies, all kinds of needs and supports that they can get. So, you know, kids oftentimes can nag their parents to stop smoking. So you kind of get them on their parents' case and maybe they'll make some changes, or at least try to smoke outside with an overcoat on. But best you can do is try for that one. And 802-QUITS is great. I think that's it. More slide. This is how you nominate yourself, your school. It's great. I would recommend doing it. It's a really easy way to kind of get extra credit and get your school checked out and assessed. And that's the link right there to kind of pop on. It's really easy to do, not hard to submit. So kind of that's what we've got for you today, asthma triggers and the Envision walkthrough. And we're open for some questions or concerns or any discussion you have. This is your time. You get Dr. Cowan here, so, and it can be off topic. It doesn't have to be on this topic if you want.
I have a couple questions. I know that the recommendations or interventions that you were sharing earlier said they didn't address outdoor air quality, but are there just some general guidance people can follow? I'm thinking like when we had wildfire smoke, we got a lot of questions last year. What can I do?
Yeah, and I think at that time we were learning from other states, right? I know that VDH was working with some other health departments like Washington and other places who deal with this every year. So like what guidance should we give? And I think some of the challenging things were like individual patients too that we get called from, that not everybody had trouble. We were having people follow the outdoor air quality guidance, and people really pretty good at learning when things are like lower levels of particulate and safer times to go outside. But some people are pretty symptomatic even when the levels weren't super high. And we know that not everyone's house is a lot better than outside. So it is sometimes hard, you know, maybe they're just as okay being at camp or outside or doing things when their home is, you know, kind of equal to the outside, because we don't have air conditioning, the windows are all open, we can close them, but then it's not keeping out a lot. So we have been advising people to follow those outdoor air quality guidelines for people who are symptomatic. We have had people need to do their yellow zone to be able to participate in normal activities, or if they're more symptomatic. It's depended a little bit for kids on whether they stay on their maintenance medications through that. A lot of kids wean off their medications for the summer, and that's a discussion I've been having, is if they clearly had trouble and could not come off for that reason last year, and we're seeing some of the same, they may consider that. But it's not a hard no, that if they haven't had trouble, we still try to wean their medications if they're not having triggers. So it is challenging, because I think it's going to be a problem that we tend to see. If people can use even window air units, if they can use HEPA filtration, that can help improve the air quality in the house for people to have access to that. Even if it's just in a smaller part of the house, that can be helpful, like where they sleep.
Really helpful, thanks.
I was going to ask you, Michelle, if it's really great to have you on today, if you wanted to share any comments or experiences with the Envision program, and if there's anything specific to share, like feedback you've gotten or things that people think is helpful, or other comments that you have.
Sure. Yeah, I think the Envision walkthrough is just a really nice tool. We get a lot of positive feedback about it because it's something easy to do. It doesn't take a lot of time. Depending on the size of the school, it might take about an hour. Smaller schools, it'll take less. A really big school, it might take longer. But especially if you have the right people at it, you can answer the questions pretty quickly. Usually a facility manager will know a lot of the answers to the questions, but we don't necessarily want it to be one person doing it. I think it's a better exercise when a group of people do it and they represent different areas. So maybe the facility manager, school nurse, an administrator, a teacher, maybe even a parent or a student if it's like a middle school or a high school. And so it's a really great tool to get that group together and start seeing what things there are. And if a school has never done an Envision walkthrough before, doing it for the first time and having a baseline, and then doing it every year. So you can kind of trend things over time and see like, oh, the first time we did this, we found all of these things that we wanted to improve upon. And, over the years, we've tackled one or two of these things, or we tackled the really easy things. And now 5 years later, we want to try to tackle one of these things that maybe is a little bit more expensive or that we planned for that took a lot of time. So it can be a really cool tool. And I would encourage using it. And it ties in really nicely with the Asthma Friendly Schools nomination, nominating for recognition, which is due at the end of this month. And it's one of many things. The Envision walkthrough is one of many things where you can earn points towards that nomination on the application.
Michelle, do you find that schools have just a wide variety of changes that they make, or are there any things that are pretty common that most schools tend to change?
Yeah, there's a lot of things lately have had to deal with cleaning products, or the Envision walkthrough doesn't cover essential oils too much in detail, but it does talk about products and fragrances generally, and that has come up a lot as a topic. So just trying to remove hazardous products from the school environment in general is something that comes up a lot. As you saw in the video, it's a lot of little things, and it could be anything in any particular school. It might be that they don't have walk-off mats at the doorways, or maybe they only have it at the front doorway, but they don't have it at the side entryways. And that's just a really easy way to prevent dust and debris and all those things that can potentially impact people's breathing from getting into the space. And it also makes a big difference because if we're not letting all of that dust and debris come into the school building where people are working, where kids are learning, then we're not having to clean as much and use as much cleaners. So it's a win-win.
That's great. That's really interesting. I think that is something we see patients in with from time to time as triggers with the cleaning product. I think we saw it more during COVID. It maybe now, probably because I learned that on here, is that that's why as a parent I see like don't bring the cleaning product or things. They have a certain thing probably to try to reduce that. And I think with all the cleaning that it's very well helpful for germs, but it's probably not good for the breathing and the skin. But we did have some kids with those complaints that ended up either bringing their own products or just saying that they shouldn't use any products on their desk because they were having some breathing problems from being close to it. And then the essential oils as well. We have those from time to time, exposures. And it typically is like recurrent symptoms related to that happening that are pretty believable. So if they're in a certain room that has it, then they have it and are out a lot, or like daycare, some of those settings. And it tends to be like that nebulized, like the diffuser where it's in the air rather than something just sitting there, that we end up with the complaints for. And I'll say that those make me a little nervous because we had a child have a scope because of the cough that they had related, and they found oil in the lawn. And there probably is not a lot of other explanation because that was the family's complaint and that was what was in there. So there's a dramatic example, I guess, but that does make sense. We're all aware of those things.
Another question that I have is about, and I'm just thinking about the flooding that happened last year, the summer last year, and all the mold that families are dealing with or schools are dealing with, or dealt with, and knowing that that's a potential trigger for some people. Did the flooding sort of increase exacerbations that we might have seen in the state because a lot more people may have been exposed to mold than typically would have?
It's a really good question. I think it will be probably interesting to see when that data is about, like by county, what the asthma burden and exacerbations, because I'm actually not sure. I think that definitely could be a factor because we were seeing that just really difficult circumstances of the outdoor air quality being really abysmal, and then the mold, and then people exposed during the cleanup process, and the heat, and also the viral patterns around that time were picking up as well. So it's a really difficult time of year where we've been seeing, like post-pandemic, a lot more exacerbations, and at least don't really to see if there's a peak related to that. I would assume that, yeah, that is probably a factor. But I think, kind of demonstrate those, studies on the hours, it's really challenging to drill down what it is, but it's really, dangerous and concerning circumstance where everyone was stuck with that, either existing in their home or school or the cleanup process, and then combined with those other pieces as well.
Yeah, it's just something I've been thinking about a lot, knowing that with climate change, we're going to be seeing more and more extreme weather events like flooding, and people are going to be experiencing it more and more. So, at the health department, we're trying to get messaging out about if you're flooded, how to dry out quickly and, take care of things so that you can try to prevent mold as much as possible, but it's not always possible. So, just curious. Thanks. All right.
I think it's okay if we wrap up early if there's no more questions.
I've got one more.
Yeah.
So ventilation and filtration is a tool, or are both tools to use. They tend to be a more expensive tool. They're not those like easy, low cost, low hanging fruit things. And so, are there any resources to help families either install a ventilation system or filtration? Maybe that's part of the weatherization and health initiative potentially.
Yeah. So that's something we're working on, is getting families who are eligible enrolled into that. It doesn't at this time, help with families like in a multi-unit apartment that's larger, but for smaller apartments or single family homes, or like a multi-unit single family home, that is feasible. For the general things like the ventilation, filtration, or depending on what it is, like sometimes are the lower cost option, like versus taking something out, if you can't. But it's not always as effective. Like if you really want your gas stove out, things like it'd be better just to swap it out rather than doing all this filtering that, may not take everything out. But I think that's a challenge that we run into in our clinic as well, is that a lot of families have these concerns. Some things are lower cost than others, but addressing all of them is really challenging. And I think that it's great that we've been able to get a few families in. The program's winding down because it was a temporary pilot. We're trying to get at least a few more people in. And then it's evidence-based. So there's other states who have some longer term programs. And it would just be feeling how that part would be sustainable, or could a few families get this? There are other avenues into weatherization programs. I think what we found with this one is that our clinic got some grant from the hospital to cover like the air filter and some other pieces that aren't covered with weatherization. And we've had families on the list for weatherization for a while that this helped bump them up on the list, and this part is no cost. But I think it's trying to figure out the systems to make that work. But we don't have a long-term thing where we can say you need an air filter, you can do this. I had a patient recently reach out to have a letter of medical necessity so they can use their health savings account to buy a HEPA unit. And that's really reasonable. It's interesting that wasn't covered, but that's easy to write a letter saying that will help their allergies, and it's a good thing to have. But we don't have a resource for like long-term home visiting or making these resources. So just depending on what relationships in the community or other programs have, and sometimes that depends on where people are located too. I don't know if you have other ones, but I think long-term it's pretty limited for that, and it's a big need.
Awesome, thanks.
I wish I had an answer to that one. If you have an answer to that one, reach back out if you have one come along.
Yeah, I think we're in the same boat.
Yeah.
Okay. Looks like Molly hopped off, so I think unless we have any other questions amongst ourselves, we're probably okay to wrap up.
Yeah.
Okay. Thank you both.
Thank you. Thanks for doing this. That worked great, Michelle. Thank you.
You're seamless. You're perfect.
Yes. Thank you.
Thank you.
Bye.
Bye.